report. So the PV is being classified into two types. One is ICSR, which is individual case safety report. So individual case safety report. Individual case safety report. And now the next one is aggregate report. Aggregate report. So now altogether reports comes into, many reports comes into aggregate. Single cases will come into ICSR, which is individual case safety reports. Now the ICSR, probably we are looking at ICSR, the individual case safety reports. ICSR case reports are being classified into two types. One is pre-marketing, and one is post-marketing. So now simple answer where you can understand is to understand pre-marketing and post-marketing. So say for example, there is a lab, and from lab you have gone to PCT, preclinical trials, and from preclinical trials you went to clinical trials, which is phase 0, 1, 2 and 3, and then you went for phase 4, and then you went for market. So now this is the discovery model. But in this, if you see, you can expect that pharmacovigilance comes into phase 4 and market. But the reality is it starts from clinical trials. Because during the clinical trials also, you will have something which is called as adverse event, which has to be handled as per your pharmacovigilance. So now the story starts here like this. There are two types of individual cases. One is pre-marketing before it comes into market. One is post-marketing, which is your phase 4 or market pharmacovigilance. So this is about clinical trial cases and as well as the marketed cases, pre-marketing and post-marketing. So now we need to classify pre-marketing and post-marketing. So now generally in pre-marketing, so I'm taking it as pre-marketing. So pre-marketing, who are the individuals who are available here is, one is you have subject or patient, and one is investigator, and one is sponsor, and one is regulatory body. So now the adverse event happens at the subject level. So here the point is adverse event occurs at the subject. Now subject will not be in a position to go and report it to sponsor, or subject will not be in a position to go and report it to regulatory body. So these two ways will not occur. Because subject has only one point of contact, which is called as investigator. So these two ways will not be possible. Subject cannot go and report it to sponsor. Subject cannot go and report it to regulatory body. So you can put it like, why we cannot report it to sponsor or regulatory body? Subject has only one document with him, that is informed consent form. In informed consent form, only investigated details will be given to whom the adverse event should be reported. So now we are going to skip this point, that subject cannot go and report it to either the sponsor or to the regulatory bodies. So either to the sponsor or to the regulatory bodies. So but investigator, the adverse event will be reported. So the adverse event will be reported to investigator. The subject will report to investigator. Now investigator also cannot directly report it to regulatory bodies. Investigator also cannot directly report it to regulatory bodies, because investigator does not have contact details, or investigator does not have the drug in market. So he cannot go and tell regulatory body saying that, okay, this drug has given this adverse event, because it's still in the research model. So now investigator, what he will do, he will go and report it to the sponsor. So investigator will go and report it to sponsor. And now coming back to sponsor, will report it to regulatory body. Now here the question comes, who is the party who works on pharmacovigilance? Then the person who is sponsor is responsible for pharmacovigilance. So sponsor is responsible for pharmacovigilance. Sponsor collects all kind of adverse event from investigator, assess it whether it is related to drug or not related to drug, and then sponsor will report it to the regulatory bodies. So now this is the model which you have in pre-marketing. And now one more point we need to understand. All the adverse events will be reported as ICSR. Answer is no. So ICSR means most of times we only report the serious adverse event. The serious adverse event. All the serious adverse event should be reported, but adverse events will be reported till sponsor. Sponsor might not report it to regulatory body as individual cases, but sponsor will put all types of cases in aggregate report. But immediate action should be taken on the cases which are serious in nature and which are the adverse event in nature. So this is about the pre-marketing. Coming back to a case which is serious in nature, unexpected, unrelated to drug. A case which is serious in nature, unexpected, unrelated. So a case which is serious in nature and unexpected, unrelated. Okay, so it's very dangerous one. So the one which is serious, unexpected, and related. Now subject will go and report it to investigator. Investigator to sponsor. The timeline is 24 hours. The timeline is 24 hours. And now sponsor to regulatory body. The timeline is either 7 days or it's 15 days. Either 7 days or 15 days. 7 days for death and life-threatening. Death and life-threatening. 15 days for all other criterias. For all other criterias. 7 days and 15 days. So sponsor has to report immediately without any delay, and it is calendar days. It's not working days. It includes your Saturday and Sunday. I'll repeat it. What has to be reported? A serious, unexpected, and related cases. Subject will report it to investigator. Investigator will report it to sponsor within 24 hours. You have to report within 24 hours. The investigator can't delay this. And these timelines are being asked in interviews also. So within 24 hours of timeline, the cases should be reported. And then the sponsor to regulatory body, if it is serious, unexpected, and related, if it is death and life-threatening, it will be reported within 7 days. If it is all other criteria, it reported in 15 calendar days. And investigator will report it to sponsor in a format of CRF, case report form, because this is being conducted in clinical trials, or it is also called as pre-marketing pharmacovigilance.